Right, we'll go ahead and get started. Aloha mai kako. My name is Lisa Ka'anoi with the Native Hawaiian Health Scholarship Program at Papa'olalokahi. Mahalo for joining us today for Adapting and Persevering Through Nursing in the 21st Century. So this will be recorded. In the future, if there's a webinar that you'd like to see but aren't able to, as long as you register, you will receive the recording. For questions or comments, you may use the Q&A feature or the chat feature located in the Zoom toolbar at the bottom of your screen. If this is the first time you're joining us, you will be automatically added to our email list for future presentations. And then last, at the end, a survey will pop up. We'd like to invite you to share your mana'o with us. This is how we get topics for future webinars. And if you have to run, you don't have time to complete the survey, we'll be able to follow up with the email on Monday. So I will go ahead and introduce our guest speakers. So let's start with Josette. So Josette Dudoit was born and raised in Nanakuli, Hawaii. She has earned various academic degrees, such as her associates in arts, bachelor's degrees in philosophy, nutrition, and nursing, and her master's degree in nutrition and nursing. Josette is a two-time Native Hawaiian Health Scholarship recipient from 2007 and 2012. She is also a past recipient of the 2011 Robert Wood Johnson Foundation New Careers in Nursing. While embarking on her first scholarship obligation as the only registered dietitian on the island of Molokai, she decided to seek a career in nursing to help fill in the gaps of healthcare in the medically underserved populations and healthcare shortage areas. Since graduating from the University of Hawaii at Manoa in 2014 with her nursing degree, Josette has been working as the clinical manager and family nurse practitioner, providing primary care and specializing in nephrology with Dr. Eugene Wong, one of the leading nephrologists in the state of Hawaii. Now, Mr. Medeiros was born and raised on Oahu and went to Assets High School and then completed his undergraduate degree in history and Hawaiian studies at Brigham Young University, Hawaii. While at BYU, he had the opportunity to sail on the Hawaiian voyaging canoe, Yosepa, and learn the values of teamwork and communication. He then completed his nursing degree at UH Manoa in the master's entry program into nursing and the master's program in the family nursing practitioner program. Along with currently providing primary care for the patients of Lanai Community Health Center, he is the associate medical director there overseeing the day-to-day operations at the health center. So I'm going to go ahead and turn it over to Josette and Jared. See if we can get them to jump. Aloha.
And aloha, everybody.
Aloha. And then we can ask whenever you're ready, Lisa, to start the PowerPoint.
Okay.
Let me see something.
There we go. Can you see that?
Yeah.
Perfect.
Okay.
So as Lisa has the first slide up, that's what we're going to be talking about, Jared and I. And I just want to thank everyone who came today, who had the time and registered to watch us later on to give as much information of what navigating through academia and the profession of nursing now as we're going through the pandemic of COVID-19. I also wanted to give a shout out to all of our nurses who are working really hard. It's like nursing month and we really want to mahalo piha and give much gratitude to all those nurses who will watch us now, watch us later, maybe later a couple of weeks, because you guys, you know, those long hours being frontline workers, being part of the team as not being frontline workers, because every position is an integral and crucial part in delivering healthcare. So we would like to give a big mahalo to all the nurses out there. You can advance the slide. So our objectives, we're gonna try to be as thorough as possible to make this the best 1 hour experience ever. So we're gonna talk about what our experiences Jared and I had to lead us into nursing, and what our experiences are during our RN and our MSN program here on Oahu. We're also gonna touch bases on how to prepare yourself, like, hey, I'm a nurse now. What do I do now? How to get yourself ready for that marketplace? What kind of job pay to expect? Because I think we all have a job pay in mind that we think we should start at. And then navigating through what's going on now with nursing in the 21st century on transitioning to telehealth, and how are we serving the people of Hawaii and abroad. So the first objective, how we're gonna work this webinar is Jared will go ahead and do his part, and I'm gonna come in and do my experiences, and to not overlap or to not repeat ourselves, and kind of guide you through this as we go along. So I'm gonna give Jared the first part of his experiences that led him into the journey into nursing.
All right. Thanks, Joe. Yeah, just again, super grateful to be here to share kind of our story of where we are and how we are today. So my kind of experience of what led me into nursing kind of started, as a youth doing Boy Scouts and learning about first aid and CPR training, and just being really interested in that. That really kind of set the foundation for me to kind of want to learn more and always kind of have that to build off of. And then it progressed into, getting really involved with learning about Hawaiian history and, voyaging, and just being really interested in our culture and the health of our people. I think that's a really big thing that I always strive to kind of keep in mind as I'm doing the things that I do is, how can we improve the health of our people? Because, if we look at our history, where we were and to where we are today, some big differences that, really have some impacts on how we do things today. Kind of how I got started in this whole journey was just volunteering. A close family friend of mine growing up in Wahiawa, she was a paramedic and EMT, and so she just said, hey, if you're interested, just go volunteer at the hospital, at Wahiawa General Hospital. And I think that's the one thing that really started me on this whole process is, as a somebody that wants to do something, you have to be the one to take the initiative and kind of step out of your comfort zone and figure out if it's something you really want to do. And so I literally just walked into Wahiawa General Hospital and just said, hey, is there a volunteer program? And they led me to the person that I could talk with. And, it started as being the door opener at the emergency room there at Wahiawa General. They just needed someone to help open the door. People were coming in. And that's what I did. And, it was a great experience that kind of set the foundation for me to see what healthcare is about. Being dropped in the emergency room to start off was pretty eye-opening. Seeing everything coming in through there, and then just seeing how the healthcare team works together, with the nurses, the physicians, and then, of course, the ER techs, who I was kind of more at that time just, communicating with. And then it progressed a little bit further, once I was volunteering there, and, it showed that I was dependable. I showed up when I said I was going to show up. They offered me a job as a transporter at the hospital. And this was really, I think, even more kind of ingraining me on that path of getting into healthcare. As a transporter, I took patients all over the hospital, from the floor down to imaging, to the laboratory, all over, wherever they needed patients to go or things to go, I was involved in that. And that even more so just kind of opened up my eyes to seeing, okay, how does surgery work? How does the ER work? How does imaging work? How does the floor work? How does the ICU work? And it really showed a lot of different things that really helped me see, hey, this is something I really want to do, And then it kind of graduated from there to working in the operating room as a surgical assistant and having that opportunity to work shoulder to shoulder with surgeons and doing procedures and surgeries. And even more so, that just, further solidified what I wanted to do in becoming a nurse and, progressing my education. And during that time while I was working in the surgery, I was taking a lot of my prerequisites for UH's MEPIN program in anatomy at Leeward and everything. And so it was great just kind of having, my own one-on-one lab time, per se with the surgeon and seeing, the anatomy and things that they're doing things. And I've also found really key just to not be afraid to ask questions. I know sometimes we may be a little bit worried about, oh, I don't know what to ask, or, but I was always kind of inquisitive and, always would ask the surgeons, hey, can you just kind of talk me through what you're doing or what you're thinking? And that was really great, because then they would, deep down, I think they all love that opportunity just to teach and to share, what their passion is and why they enjoy doing what they're doing. And it was great because they got to, kind of talk about anatomy and everything that they're doing in surgery. And it was just a great opportunity too. So I'll hand it over to Joe, take it from there.
Okay. Yeah, Jared made a good point about asking questions. Don't be afraid. If you're afraid, then you're lost. Yeah, and we'll touch upon that about adapting to the environment that you're in. So as we're presenting this, we kind of are focusing on Native Hawaiian health issues. I know it's very like a small population, but we want to do it as thorough as possible. So just hoping that everybody can get a little bit of information that they can use to, take home with them. So what led me into nursing, I didn't know what I wanted to do. Public school, nothing to do, play all day. I decided that, hey, I guess I have to go to a community college. So, and I have no shame in that as well. So I started my venture at Leeward Community College and didn't know what to do. I repeated classes because I still wanted to go out to the beach and surf. I had no guidance at all, so I really didn't have any clue what was out there, but I know I wanted to help people. So the people I hung around with in my chemistry classes, they were advancing themselves and wanting to go to medical school. So that's how I started my journey. As I got better grades, I became the general chemistry tutor and a ho'oulu program there for Native Hawaiian students. As I progressed through Leeward and I got my AA, I was thinking, hey, let's do pre-med. How can we go forth with pre-med? What do I have to do? Counselors at that time helped me, but you have to help yourself. So I didn't know what classes to take. So you kind of, I'm the student who sits in the back and never in the front. So it took me a while. It took me about 3 years to figure out, am I gonna stay at Leeward or am I gonna progress to UH Manoa? So as I got my associate's degree, I transferred over to Manoa, and I wanted to be a competitive student because every pre-med student was a biology major. So that's what led me into philosophy, because that's what I thought would make me competitive and make me stand out as a Native Hawaiian with a degree in philosophy but a strong science background. As you sit out and you look at everybody and you say, man, I don't know what I want to do still. Do I really want to go to medical school? As you progress and you fill out all your applications, and health at that time in my family, people had diabetes, they had high blood pressure, no one wants to listen. And I said, you know what, maybe I want to prevent people from being sick. So how do I do that? So as I graduated in philosophy, I decided I didn't want to go to medical school and I wanted to pursue nutrition because I thought that that was the way to help people into making a better, healthy lifestyle to decrease chronic disease or even manage a chronic disease better than taking medicine. So I got word of Native Hawaiian Health Scholarship, and that's how I got my first degree, going to Ball State University as their first master's in nutrition for Native Hawaiian Health. So as I progressed in that area, I also volunteered with hospice. And I knew that I wanted to go into nursing. And all this time working and going into academia, you know, you get a lot of people that look at your resume or look how much schooling you had. And, you know, and it is the real world out there where people will say, hey, you got plenty of degrees. How come you still going to school? I said, well, I don't know what I want to do, but I'm going to get there. So I try to tell people, you know, this is a journey. It never stops. I don't think it ever stops for some people because we still wonder what else can we do. So that's what I did. I ended up still working really hard. I still had a scholarship. I became that registered dietitian, working on the island of Molokai as their first registered dietitian, and, you know, giving back. And it was an eye opener, because as you get placed as a Native Hawaiian health scholar, you have to, I say, be the taro in the lo'i patch that needs to provide for the land. And looking at those gaps in healthcare as a registered dietitian on the island of Molokai, I did live there for those 2 years. So I lived, eat, and breathed the land there, and it was hard to gain the respect of the people that live there, because I would always be labeled the Honolulu girl, even though I'm not from Honolulu. But it was great because I not only got to meet family that that for my genealogy, but it was an eye opener to saying, hey, nobody listens to me, they listen to nurses. And they're not listening to registered dietitian how I want to help them. I can't take a blood pressure. I can't do all the things that I can assist a doctor better. So as I was traveling back and forth from Molokai to Wisconsin, because my husband at that time was doing a degree there back in 2009 and 2010, I decided that I wanted to educate myself more. So I heard of master's entry program, and it was at UW Milwaukee that it was the thing to do now. People wanted to engage in healthcare at a higher level and like complete it in a faster manner. So I decided to go to one of the college campuses when I visited my husband in Wisconsin. And it was an intense program. And I thought to myself, I don't know if I could do this, because how do you smash 4 years of a BSN into 9 months? We already hear nurses having trouble doing it in 2 years. And it was crazy. With the support of my husband, I applied. I had all the credits. I didn't have to redo any classes, because if you show that you were using all of the microbiology, which all of that was entailed as a registered dietitian, all I had to do was apply and see what prevailed from there. And then that's how my journey in nursing became. I mean, if I didn't serve as a scholar on the island of Molokai, I don't think, and my husband, you know, kind of leading me in a path like, hey, do you think you want to do this? Or, you know, I wasn't that well educated in searching on Google, or like how Jared was looking for programs. I open a lot of opinions. You have to be very open, but and do your research at the same time, and kind of believe in yourself, because it was a journey for me. And if it wasn't, like I said, for Molokai and being placed there, I probably would not be a nurse today. Next slide.
Yes, I can vouch for sitting in the back of the classroom. That's where I sat too, and that's how Joe and I kind of got to meet each other. And that's where it started with our relationship. So going to the MEPN program here at University of Hawaii, now called the GEPN program. So Joe was lucky; she had all of her prereqs. I had to go through and, you know, scrounge up all of my prereqs through KCC and LCC. But that really was what I was looking for too, was just a way that I could get into becoming a nurse the most efficient, or the way that worked for me at that time in my life, you know. If I knew from the beginning what I wanted to do, yeah, I think I would have done the BSN, you know, that would have been ideal. But again, I think as Joe mentioned, you know, as we go through our journey in life, sometimes the way that we get there doesn't really matter. It's kind of where we end and what we learn through going through it. I think that's what, you know, we can show here. And so being, you know, in that program, yeah, Joe is correct. It was a very intense 9 months of, you know, our lives. I still remember the first day that we had our orientation. You mind me sharing that? Joe kind of,
It was awkward.
Joe kind of stands up and says, "Hey, I'm Joe and I'm pregnant." And so, yeah, so it's like even more so to show Josette's, you know, dedication to her family and to her integrity and everything. You know, she, you know, ended up having a family through this whole process too. And, you know, we were at clinicals and, you know, again, just more props to Joe to, you know, get through all that. And, you know, it's amazing to see where we are today. But yeah, clinical rotations at hospitals. So I actually moved to town to, you know, make that more feasible for me and my family at that time. So just living in town that we could be close to Queens and all the HPH facilities, you know, do clinicals. And then, you know, getting to that point where we have to pass boards, you know, that was pretty stressful. Like we had to have our RN license to get into the next part of our training with the nurse practitioner part. But I think as you go through that process, there's a lot of our classmates that, you know, we got really close with and we could rely on for team support. I would say the one class that I really enjoyed the most would be advanced physical assessment. And I feel for me, that just really kind of brought full circle what, you know, I needed to learn and what I needed to know to help be a good provider. You know, that was the part that I really enjoyed, was learning, you know, what am I looking for? What am I seeing? What am I hearing? You know, all those different things. It was a really great class for me that kind of helped just solidify that, hey, this is what I want to do. You know, I want to be able to know what I'm seeing, you know, what I'm hearing. So the family nurse practitioner clinical rotations, I just put, you know, that's your interview. And, you know, being that we are in Hawaii, you can't really go anywhere without anybody knowing, you know, somebody, you know, or, you know, knowing your family. And it's all a really big part of kind of preparing for your future of, you know, what you're going to do after school, you know. And that's kind of where it brought me to being on Lanai. You know, my last clinical rotation was at Lanai Community Health Center on Lanai. And it was a great opportunity. I enjoyed it. I got to learn so much and see, you know, what it is like to be in a rural island and be a medical provider. And that was a great opportunity for the health center to see who I was, and, you know, to also be an interview as well. And then boards and licensing. For me, it was pretty fast turnaround from graduating, studying for boards, to starting work. You know, I mean, I had to take my boards in October, and I was starting on December 1st. It was all set. And for me, you know, that I wanted to work at Lanai Community Health Center because of what I saw there as a student and how I could say I contribute to the population there as a provider. And, you know, it was just a great opportunity to kind of go through that process of being there as a student and then to come back, you know, to be there as a provider. You know, I don't look back at, you know, that decision. I think it was one of the best decisions for my family and myself to end up on Lanai. You know, people may be really, you know, oh, you want to live on Lanai? That's crazy. You know, yeah, I'm a boy. You know, I do miss having, you know, all the things that were available to us here in Oahu, but I think the advantages of being, you know, provider on a rural island, for me and my family, was the best decision that we made. And so when I look back at, you know, how we started from MEPN to our nurse practitioner courses to today, and then, you know, Josette and I managing patients together, you know, it's been a great opportunity. So I'll start over to Josette.
So as I probably might pick on Jared too, because I want him to share some of his nursing experiences through our clinical rotation, because I think that's key to this presentation as well, because you can only hear one side, and sometimes it's the candy coated side, and people don't realize you have to, there is a type of appropriate behavior and how and when to act into advancing yourself as a nurse, whether it's a student or as a professional practitioner. So as Jared was saying, we went through the MEPN program, and I'm gonna go through the RN, and then I'm gonna go through the MSN program. So the RN program, clumping those 9 months in it, no matter what you hear, every program seems to be disorganized because there's always a turnover of faculty. But it's you as the student to get what you need, get your hours, and learn as much as possible as you can. And sometimes you don't get the rotation site that you would like to, but you got to make the best of it, because lucky you get one rotation site. That's what I would say. And it was a challenge because, like I said, I wanted everybody to know that, hey, I'm going to have my child during this my RN part. And it was tough because I was the first student of the kind to even embark on that journey. So I had to have special permissions, not only from my physician, but from the school, to allow me to go through the program as well. So I wanted to make it clear at orientation that I was pregnant, everyone. So hey, crazy Hawaiian check. But like I said, the nursing experience, the nursing program, what do you want to do? You know, I did have a scholarship to do my master's part, but my RN part, being a working mom still, I had to make things work, and you can make it work. That's what a journey and your experiences do. I was catching the bus, no doubt in that. I did have a car, but you know, gas, parking, all that stuff adds up when you have financial loans that is paying for your future endeavors as a nurse. So I tell people there is always a way to do something. You might not like it, but it just goes to show that this is what you got to do to get where you want to go. So I was catching the bus really early in the morning at 5:30 from Nanakuli all the way to UH Manoa, and even sometimes to KCC or Leahi, where they were just putting in their lab, their virtual lab, that now they have that multi-million-dollar lab on Manoa campus. Yep, as big stomach as I was hopping on that bus really early in the morning and going back home like 9:30 at night with a big stomach of mine. And it was a journey, and it made me appreciate life and health and what we do for our family in the future, and how we will provide, and you know, sharing that experience and mana'o with everybody else who is gonna watch this or share it while you're eating potato chips and drinking some soda on the side later on. So we don't have a lot of places here, but I went to Kapiolani, Kaiser, and Palimomi for my rotations. And I always tell students, if you're an RN watching this and you're a student or you already went through that, it's really hard to set yourself up in any realm, whatever background or socioeconomic, because everybody is treated the same. But you'll have some people that you say like, oh, that person is, you know, getting special treatment. But you know what? Everybody, no matter if Jared was a nutritionist, I had experience as a yoga instructor, or this person came from everybody literally in the program, whether it was MEPN or I hear BSN students, everybody literally is at the same level. Your blood pressure will be the same as mine maybe, but you know, everybody is at the same level. But you do have to put those hours and learn. So the interesting things I learned, I think Kaiser was my best rotation. I really chose that because it was the closest to home. I didn't have to pay for parking, but I did have to walk up a hill. But I learned the best skills there. And I know a lot of people shy down on Kaiser because we hear all kinds of things about it. But I got to do a bedside femoral catheter. So I'm very well versed in dialysis as a registered dietitian. So that was up my alley. And I was quick to jump in and say, hey, I'll do it. You got to do that. When there's an opportunity there, just do it. No matter if you know or not, you'll think fast. I got to put maggots in someone's wound. I got to do a wound vac with another Native Hawaiian health scholar, Ty. at Kaiser because we both had a rotation together. And I got to do a code with another friend of mine from Hilo, and she's also an APRN that works here in oncology. And we got to do a code, a real code drill with a patient that we were taking care of. And not a lot of people get to do that, but it was intense and exciting. And if I had to do it all over again, I probably would tell people to go to Kaiser. And that was all on the first floor. It was nowhere else. And then Polimomi was another place that very relaxed, not as relaxed as Queens or Kapiolani, but you learn a lot of stuff. But like some people, they go to, like, where did you go to do your RN?
So I was at Strong, and then Kapiolani, and then Polimomi, and then also Hawaii State Hospital. So
That's right.
yeah, so those are again, yeah, I think Joe was really picking up on key things. Even though it may not be the place that you wanted to end up at, it doesn't matter. You know, it really matters your mindset of going into that clinical rotation and making the best of it, and really putting the initiative to be there to learn. You know, those nurses on the floor that, you know, I got a chance to, that we all got the chance to work with, they were some of the greatest teachers, you know, ever. Even though they don't have that teacher under their name, it has, you know, even more so just the experience and the love that they have for the patients, and just their ability to share what they, you know, never know from all those many years of being a fantastic floor nurse. That, you know, I think that stuff still sticks with me today.
True. And then I'm one of those people, if you really want to do what you really want to do, I like to always say, oh, just suck it up. So as we were ending our RN clinical rotations, we had HSH together, the Hawaii State Hospital, where everybody is legally mandated by the law to stay there for whatever reason it is. And I just gave birth to my first child January 2nd, and we had to do a self-defense class. And I literally was 1 week postpartum. And I had to suck it up, because if I didn't attend this self-defense class, there was no way I could do the rotation and I would be out of the program. So of course, what do you do, right? Suck it up. So what was I doing at self-defense class? I was obviously kind of saying, hey, if I gotta be here, nobody else should be grumbling. As I'm pumping, I was breastfeeding, and I literally just gave birth to a baby. So sitting down on a hard desk, they literally had an old-fashioned wooden desk to sit down. I swear we were in the scariest basement ever at night, because we had orientation in the dark, I swear. But those are things like, hey, like, now we're sharing it with you guys. It was funny. It's funny now, but not funny at the time. But those are the experiences you can tell other nursing students. I mean, as we progressed and we did the whole RN part, for us in the MEPM program, you gradually already get into your master's level as you're already sitting for your board exam. So as we finished the RN part and getting our boards by the end of the next year, which was 2012, about there. By the time you did your advanced physical assessment lab, you had to have already passed your RN boards. And our class was actually the only class that I think was about 100% first time pass rate. So that was great. The school offered us like a Kaplan review, and I encourage people to do that. Even if you're doing your master's part, there's other programs out there for you to study for the boards. But yeah, as we progressed in our masters, I did my rotations at Waianae Coast Comprehensive. I did like a full year there, as well as Straub. So, you know, experiencing Waianae Comp, a lot of people don't, if you don't understand that population and all the healthcare needs that community health center has to provide, I feel that's a really good place to practice your hours there, because you see everything from impetigo to scabies. You learn a lot. You learn a lot of newborn stuff there. You have the opportunity to start prescribing medicine. Of course, it will be signed off by your preceptor. And you get the opportunity to do well checks at all levels. And I know a lot of people are shy when we do well checks for older boys. if we're a woman, because I was kind of uncomfortable because it's like, you know, you see kids or they call you auntie. You're not auntie today. You are the healthcare provider. So you have to make sure you, as a student, you know how to appropriately adapt to the environment that you're serving at the time. And then Straub with Dr. Terry Tanaka, I think that was a really good rotation for me. And I would always tell my fellow students, my fellow classmates that, you know, this physician, because a lot of us, we don't get to shadow physicians. We're shadowing other nurse practitioners. And I really wanted to, I had the opportunity to shadow a physician, and she was a pediatrician. And she was a really good pediatrician, so good that it made me nervous every day. And I had like stomach aches for life because I wanted to make sure she knew that a nurse practitioner student is just as good as assessing. Now I'm saying assessing and diagnosing as a physician, because that's what we're trained to do, to assess someone and to make sure we make those differential diagnoses and then narrow it down to what are we gonna diagnose this visit for. So it was a really good foundation for me for the pediatric side, because I got to see a lot of things that most other rotations didn't get to see, like a medication drug reaction or gingiva stomatitis, like inflammation of the gums that had cold sores everywhere. And then my super last rotation, I got to do with another physician in nephrology. I was actually supposed to go to the Big Island, but things fell apart. And I was gonna have to bring all my family there for like a whole entire summer, because at that point already, I actually had my second child during that rotation. So I had one child in January, and the following year I had my next child in February. So Dr. Eugene Wong decided I think I was like his second student that he was taking on, and he's never taken on nurse practitioner students. So I learned a lot, and I was grateful because as a registered dietitian, I was well versed in nephrology. So now I could see like the medicine side or the advanced nurse practitioner side of how to do nephrology and how to treat patients. So as Jared was saying, we were done and you're in your rotations, and it's basically your interview. Placement and interview was it's really hard, especially if you're a scholar. You need to be placed in like a category, right? And you're ranked. So it's very hard to do that because we all want to go a certain place and we all want to do certain things. But I was happy to be placed here on Oahu, where I actually am employed now. At that time when I was being placed, it's convincing people to hire you. I wasn't at a community health center for my last rotation. So I really was just like, where am I gonna work? Because as a Native Hawaiian health scholar, the hospital is like the last place. It's like not a priority one. But luckily, as I got placed, I got to fall in the category of nephrology and private practice. So as I got hired, I had to learn everything and try to be a clinical manager that I was never. I had to look at this huge physician practice and all the medical assistants and the nurse that was working in this facility. What am I going to do? I literally was fresh out of getting my boards and stuff. So being the persevering, or to say, or adapting, I quickly learned on how to take control of a practice. So not right away, the doctor's going to trust you, but you can do the things that you were taught. So seeing patients, you know, getting your licensure and being a provider for Medicare, those things take time. And they take sometimes 9 months to a year, but you can still bill for those things. And if people don't tell you that, you have like a 9 month to 10, 12-month window for you to actively get paid for those things. But you also, like Jared was saying, you know, boards and licensing is more intense than anything, especially if you work in private practice like myself. I actually have had to go and search, and that's where you kind of network and you say, hey, how did you get your state narcotics license? Or how did you get your DEA? where do you go to turn in your APRN licensure with your check, and you provide all of these paperwork. School only tells you the minimal stuff and gives you little guidance. So to talk amongst your friends or the people you've networked with, or preceptors or mentors that can help you is very vital, especially when you're starting out as an APRN, like an advanced practice nurse, regardless of having prescriptive authority or not. So it was hard in the beginning because I think it took me like 4, 5, 6 months, and I was already practicing as an APRN in nephrology. Yeah.
Mhm.
So for me, I lucked out because Dr. Wong is a traveling nephrologist. So I had a lot on my plate, and I had a lot to learn. And I always tell students, because we do medical assistant student training and hours and RN hours here at the office, that you literally need a notebook, and you have to have that in your pocket. I show students all the time, I have this dilapidated composition notebook with all the things I learned, because if I have to ask you once more or twice or the third, you're not paying attention. So being the person I am, I had to learn nephrology from a different perspective, and I had to know all the positions in the office, and I had to go traveling. And it's hard to travel when you have kids and you take the first flight out every Friday or every Wednesday to another island. But it was awesome to do that stuff. No experience, but I learned a lot in the first 6 months, knowing the gaps and how to manage like 8 people. Jared probably manages like way more than 8 people. You just look on their website. But I mean, 8 people, 2 people, same thing, because you still, I mean, I never pictured myself in an administrative position where I have to not only provide as a provider, like see patients, but I also have to tell people what to do and then do paperwork and letters and all that other stuff at the same time. So very doable. I mean, if you really want to do something, you can definitely do it. I have to convince the physician that I worked for that hiring a nurse practitioner is going to be the best thing you'll ever do. And he'll attest to that as well. So it's very doable. You literally have to, like I say, those experiences will help you to adapt. And if you really want to do it, very, very possible with the networking. Okay, so next slide.
Yeah, I think putting on there the first year of practice, I would say it's the first 5 years of your practice, and it's just a whirlwind, experience of kind of having the training wheels off, and then actually like, oh man, I'm the one making the, the plan and the assessment and the diagnosis and differentials and things there. Yeah, I think Josette brings up a great point, previously about, transitioning from, having that nursing kind of role and then turning that into a nursing provider, but also an advanced practice provider, taking the next step further. And so it's really great to, when you're looking at a place that you're gonna get, your first job at, it's really good to see, what your resources and what your support will be, in that position, because it's really key as you start off to have a place that can help support and nurture you as you grow in that role as a APRN. And I think that's what also helped me decide with the health center on Lanai is, the medical director at that time was Dr. Humphrey, in internal medicine, and again, just a very patient, gracious physician that was open to teaching. And first off, the first day, he was like, "There's never a dumb question. Don't hesitate to ask. If you don't know, it's better to ask instead of making half-minded decisions on things." And so always being open to communicate is a real big thing that should always be a part of your foundation as a provider, as a nurse, to always be open to communicate. Being a rural medicine, medical provider is definitely different than practicing, on the major islands, I guess Maui or Oahu, where you have a lot of different access to different things. You really have to kind of look at the resources you have and be able to help your patients go through this process of getting medical care, which is not as easy as just driving down the road or going here and that's it. For us on Lanai, it's either a boat ride or a plane ride, to another island to get a CT scan. We don't have a CT scan on Lanai, so there's those things that we have to take into account to help the patients. We also become their advocate, their travel agent. Logistics and everything is a real challenge that we have to help our patients with. I'm the one sometimes calling the physician's office to schedule an appointment with a specialist because the office may not understand that they're coming from Lanai and that the first flight from Lanai doesn't arrive till 10, and they're trying to schedule a payment for 8 o'clock. The patient's got to spend the night, go the day before, and so all these different things come into play. When you're thinking about patients getting care from another island, it would be great, to kind of have our resources kind of make known to people is a really big thing. And that goes to my next point about building relationships with off-island providers. And so, every time you look at trying to get patients something that they need, there's always going to have to be a provider on the other end to kind of help you with that need. And that's where you're building those relationships of trust with specialists and providers to know that, hey, yeah, they're going to care for the patient, Lanai, and I can trust to make sure that they're going to get to what they need and all that kind of stuff. And I think that's the approach that, I've taken with working with Josette, Dr. Wong in nephrology, that we build really strong relationships as providers to communicate openly, to always be available to talk about patients, and to make sure that the care that the patient needs is delivered. So communication, again, I think, not being afraid to call and to ask is the big thing, kind of going back to when I first started, asking to volunteer. It's the same thing when you become a provider. You have to be open to communicate and to work as a team, for the betterment of the patient. We have to always put things first. And there's multiple times when, I first started, and even to this day where, I have to call their providers to ask for help to get patients care that they need. And it's a lot of cold calls, it's, just a lot of calling and, being able to critically think the situation through and communicate that with the provider so they understand, what is needed. And, now after this time, from first starting to having a very small amount of people that I could tap into that get, access to specialty care and, just assistance for patients, to now just being a real plethora amount of people that, I've worked with over the years that, we can help our patients on the night. And I think the credentialing part is a real big thing too. I think Josette's right. Just all that paperwork you have to fill out to get credentialed is very overwhelming, and it's great to have resources of other providers that you can ask, hey, how did you do this? How did you do that? And I think that's what the scholarship really helps as well, that we could just tap into those resources of other scholars who were in our shoes when they first started and how they got to where they are. We all are here just to help each other, because in the end, it all comes down to the patients and the care that we provide them, and we want it to be the best that we can.
Yeah, I was just looking at time. I think we're just like talking. I need to keep myself on the fast. No,
Yeah.
No, we're good. I think we're good. So yeah, as Jared was saying, you're BSN, MSN, whatever you are, registered nurse, LPN, no matter what, first year practice is the hardest. So as an RN, so hard to figure out, now we have a degree, what kind of work we're gonna do and how much money we're gonna get paid, because that is always what is talked about in the classroom, inside and out. Like, oh, when we're out there and we've done, oh, RN, make like joke money, in time. So like he said, the first year of anything, whether you work as an RN, so if there are RN students out there or there's RNs listening, you guys know already that you start at a rate, and your rate will be at full capacity at 2-year mark, at no matter where you're at. So you're not gonna straight off the bat get paid the full thing. And same thing like APRN in your first couple of years as well. Your pay will not be the great number you think your pay will be, because you're still a newbie. No matter if you've been an RN for 26 years and you decide to be an APRN, everybody's gonna start somewhere. depending, is it a community health center, or is it private practice, or is it the hospital? So all you gotta take into relation where you wanna work and the amount of time you're gonna put. But yeah, the first year is the hardest. And it was hard for me learning to adapt to a private practice office and be the person. I had to know my billing and ICD-10 codings really well, because now I'm given the full individual free reign to bill what I'm supposed to. And you gotta know these things. Like, I need to, if this person has a fever, that's gonna be the first thing on my assessment, because that will give me the most money when I start to put my bills through. And that's how, I mean, coding and doing assessments, you have to prioritize. And now I think you're only given the first 5. Before they used to give you 10 assessments. But those are the things you have to ask, or you learn behind the scenes as you're doing it as a student. I get the best of both worlds though, because I get to do rural medicine on the other islands and private practice. And how does that work? Because I work in the realm of nephrology. I also do dialysis on all the islands except Maui and Molokai. So every day, I put this on mute because this thing, like Dr. Wong's phone, rings all the time, because what am I doing? I'm managing patients on off island, and I'm working with other nurses. And you'll find that as an advanced practice nurse, you've been there and done that. So be nice to your fellow nurses. I know sometimes we see physicians, you know, raising their voice and stuff. And I see physicians all the time doing that. And I have a different personality than like Jared, because I'm very upfront with people and I let them know that that's just the way how I am, because it's just like, hey, you gotta tone it down because the nurse just wants an order. She's asking you for an order. Stop asking her to do something that she has no clue. She's da-da-da. So, you know, there's stuff where we have to work as a team, and you have to pull yourself back and say you were once there, or how do we better manage the patient? By yelling at the RN that I'm telling her to change an order for me? Probably not. So it's crazy because now majority, 90% of the nurses or any social worker or dietitian will call me because I have that better voice. But I do get a little bit cranky because I want the best for my patient. And if I have to be a little bit more stern, then that's what it takes for me, but in a nice way. So, and being in private practice, as the first year went on, I had more responsibilities, and my responsibilities came on a little bit fast. I also do inpatient and outpatient hospital. So I am credentialed at Queens, and I'm also credentialed at both Fresenius and USR Renal in the whole entire state of Hawaii. So I do have a lot on my plate, and I do call 24 hours. So I work literally every day doing physicians exchange as well. So when you have what it takes, I tell people you get more responsibilities. Sometimes more responsibilities doesn't necessarily mean more pay, because that I have to remind people what is nursing. I think people forget what nursing is. It's not about doing more work, you get paid more money. It's about really, what did you really come into nursing for? And I always tell people, I even tell Jared all the time, I tell him, I think I live in a bubble, or maybe I was just raised right, or maybe I just want the best for everybody, because I feel, in my opinion, that's what healthcare, or that's what anything should be, whether it's education or just something. You just take a step, deep breath. I know you want to yell at everybody to get the thing, but there's always the most appropriate way to do it. But what is the most crucial thing as a nurse? Keeping up with the Joneses. And it's funny because when I say that, you literally have to keep up, whether you're an RN or an APRN, in what's going on now. Sometimes we can't cram in 5 years or 2 years of a licensure CEUs and make it up, because sometimes we do that into like the last year we have to renew. Like right now, everybody's actually renewing for their RN and their APRN license this year. So there's a lot of stuff going on. People are trying to complete their CEUs. But if you don't do that, how do you better set yourself up for the next practice? Are you going to stay in that same work environment your whole life? Some people can. I know I will probably transition to something else because at some point Dr. Wong will retire. So those are the things you have to keep in mind, and being here, make the best of your networking. I think networking is key, because now if Jared needs to call me for something and he has a nephrology question, he calls me. If I don't know, I can call Dr. Wong. If Dr. Wong's not available, I can call on Dr. Prep. So being comfortable and making those connections to where, like, a lot of people live on their phone, and some doctors like to be called, and some doctors, most of them actually text a lot. And that's a really good way, because a lot of texts come late at night when you want to sleep, but you never really sleep. And taking those risks. If I didn't take the risk of trying to be the best I can, and you're not stepping on anyone's toes, you're just trying to look for a weakness or a link that needs to be a little bit tighter or built stronger. That was my role here in the practice. I found weaknesses, and we made it better and stronger. And knowing your role, you have to know when to step back, because I always remind myself, and I tell the doctor or any doctor I work next to, is that I am not a doctor, but I'll definitely investigate and assess the patient for you, because sometimes you are so good at what we do, and I'm not trying to boast or brag. When you get really good at what you do, the doctor will trust you with everything, like the practice. So it took me about 2 years for the physician I work with to actually leave and do his vacations like he always did. So at the second year of working private practice, I had free reign and very, very comfortable where I was at, because I was mentored very well. Next slide.
So now nursing in the 21st century, and of course going through last year of the COVID-19 pandemic, again, just reiterating what Joe said, just building those relationships. At the end of the day, when everything is going crazy, it's those that are going to stick with you to help you at that time, and that's what's really going to help carry you through, along with your perseverance and your ability to carry out what needs to be done. And that's something that we've been really looking at Lanai is, what can I bring to the people of Lanai instead of sending the people off the island for? And that kind of branches into telemedicine. And so building those relationships with providers to understand that, hey, we can do this through telemedicine, and we can help the patient out and just increase their quality of life and their care. And so at the health center, I've been able to kind of be a part of the process of having telepsychiatry, teledermatology. We built an expansive tele-OB and prenatal program. We have an ultrasound that we're able to do, ultrasounds on the island and have the reads read, remotely through like cloud technology, telenephrology, with Josette and Dr. Wong. And it's continuing to grow as we start building it more with telecardiology, and always, looking for those opportunities to have other providers bring their specialty and services to the Lanai population is always something that I've been really key on. In my role at the health center, it was an opportunity to be a medical provider and to learn how to provide primary care medicine. And then with the pandemic kind of taking the next step, the medical director, was traveling between Lanai and Oahu, and looked at, decreasing that travel just because of everything going on and just safety and everything. So then it really kind of like Josette, I was given that, opportunity to step up as a leader for the practice and to manage the clinic and to figure out how this works and how to make sure we keep it working and that it doesn't all fall down. And so that's where I put, being a leader for your team. We all have the desire to see things succeed, and as Native Hawaiians, we're always special. Care needs to be given to making sure that we do what we do to make sure that it's the right thing for the patients and for us. And so being pono and carrying that out. as we progressed through the pandemic, Lanai was great. We had nothing going on, and all of a sudden October hit, and we just had a huge, kind of surge of COVID positive patients, and transitioning our practice from, being primary care to now managing, 70 COVID positive patients, and, making sure that we can do what we can through telemedicine to make sure that they're doing okay. And then also, how do we expedite getting these patients off the island if they need to get to a higher level of care was a challenge. I just don't have an ambulance that they can just go on the ambulance and go to Queens and then their ICU. You're talking having to get medevac off the island and all these different things that come into play. And so being able to work with different agencies is very important too, with working with other medical practices on the island, the hospital, and then also Department of Health, was really key in just being a good communicator and being an advocate for the patient. And so helping people understand that, Lanai is very isolated, there's not an ICU there. There's nothing that we can really do to get our patients care without going off. And then that goes to the last one of being adaptable, with having a busy life and a busy family, and then having patients. And then like Josette, our phones go off all day long. Just being adaptable, to be flexible, and to work with your team is really immense one, is having that communication with patients go both ways. So
like, with the whole, like Jared saying, transitioning to a lot of things, there's a lot of things like as COVID progressed, right? We're in the middle of something bigger and we don't know yet. And it was happening last year. I was like, what? Telemedicine? You gotta be kidding me. We started to do telemedicine and I was like, how do we do telemedicine? We're private practice. I have to have all these different types of modalities, and all our patient population are the baby boomers who, hey, I got an iPhone, or hey, I have this, I don't know how to work it, or I don't have a computer. A lot of my patients didn't have a computer or the capacity for any type of videoing. So there had to be a lot of work too on the family's part, and a lot of nurses too. And I thank them all, because without them, we couldn't be doing telemedicine in the hospital. So as a specialist, I didn't have to go in the hospital and see a patient face to face that had COVID-19. And it was really hard because nephrology is like in the forefront. We not only have those critically ill patients that are either TB positive or hepatitis B, but they're the critically ill, and those are the people that will suffer the most. And we had a lot. Queens was booming, and I don't watch TV at all, if you guys can think about that one. But it was hard. I had to keep up with the time. So I would go on the internet, do my CDC, do my WHO, do all those things, all these organizations, get important emails from my networking system that was off in the mainland, who are very important people that was keeping me abreast with all the COVID-19 and what should I do? So, everybody's getting Clorox this, Clorox that, and I was telling patients, hey, guess what? And this is you as a nurse, you have to guide your patient in the right direction. You are the sole information specialist for everyone. It's crazy. So I would always tell them to go to Johns Hopkins website, because they have the best information about COVID-19 and how to go ahead and explain it in layman's terms. So that was a huge adjustment. Videoing versus face-to-face, we started to fade ourselves out, doing face-to-face, protecting not only our workers and not only our families, because a lot of our families have their own health issues, and we don't want to bring that into our home. So it was a life-changing experience, and I think it still is for a lot of people. And in the dialysis realm as well, I thank those nurses who hold those iPads up for me, because I don't have to go in there personally and physically, but I still can see the patient as the nurse assesses the patient for me, listens to their heart, checks for lower extremity edema, make sure that their blood pressure is good as I speak to the patient. So this whole thing with nurses, and I greatly appreciate it. Everybody's burnt out. I hadn't had a vacation yet, so I'm hoping to get a vacation and pull my kids out in December because I'm wanting to have a vacation from all of this. And, you know, all the nurses and the mommies out there, I mean, just everyone in general, I keep telling them that people just need to be reminded that we're all in it together, regardless if we're a nurse or not. Keeping updated with COVID. You know, we only hear what the hospital will report, and we don't keep up, I think. But I did do some CEUs on ANP, and it was self-gratifying to know that they had updated information, and it actually made me aware of COVID-19 and, you know, how it attacks certain cells in the body, the receptor, the protein, and the variant, and all that stuff. So, you know, as nurses, you gotta keep up to date, because when a patient asks you a question about that, you can either point them in the right direction. And I know some people, when you work in the hospital, you're only can give so much information out, but that's the great thing about being in private practice. I have full reign of whatever to do, but you want to guide them for the right information, especially people when they were trying to make appointments and everybody wanted to have that influx. I need to get I said, you know what? I can't give you anything. This is under the state's control, and I can't write you a prescription or letter, but you need to follow the order, and you have to do it in a calm way and reassure the patient that everyone's time will come. Just, you know, mind your P's and Q's, follow the law, you know, mask up, and make sure being vaccinated is a good thing, because we can share our experiences with our patients or whoever, our friends and family, to give them a better peace of mind. I mean, everything is, I'm gonna say, a research study. Studying medicine, studying nursing, without doing things like this, we would never advance in healthcare. And I get people watch a lot of television and whatever they want to, but that's for everyone's opinion. But, you know, as nurses, people tend to look towards us for answers and soothing. It's junk, because when COVID was going, it was on a rampage in the hospital. Dr. Wang and I went, you know, and visited patients, because I felt so bad that they couldn't have anyone visit them. And how would we feel if we had to, you know, spend our last breath by ourselves? And I think that's where nurses get a big shout out, because that is a big job. I don't care what anyone says. It's a big job to fill and big shoes to walk in. And no other doctor can do what a nurse does. And it's like teary-eyed, because it's just being a nurse it's a very unique position. And no matter what level of nurse you are, we all do the same thing. So flexible, adapt, and adjust. And Pono comes naturally. I feel that Pono does come naturally, and, you know, Kina Ole perseveres, because we always want to do 100% or 200% of what we do. And then, yeah, that is nursing in the 21st century and the COVID pandemic. I feel like we took like all the time. But, you know, the next slide actually gives a little bit of, I think, resources. So I put, you know, places where if you are an RN or you're doing your APRN hours, it's good to be in a group. You're automatically put in a group because you're forced to buy membership when you do your board license, but those things give you free CEUs. I've never had to pay for one except just keeping up with my board licensure. So I do 75 credits of free CEUs on my nursing, the AANP, which is at the bottom. All the other stuff is like the Hawaii Center for Nursing. You should always look at. If you are a registered nurse or an APRN, you should be looking at your regular board nursing for the state of Hawaii, because those are the places that kind of dictate if you will get your prescriptive authority or not. You might have your licensure to have prescriptive authority, but the state board nursing of Hawaii will actually say yes or no. So they actually have the last say if you can actually prescribe or not, even though you have all that licensure put in place. So I just put a little bit of tidbits up there for now. And then, you know, the last slide, we just want to say mahalo piha to everyone that's joined or will join later. And I also wanted to thank Kendra Medeiros for providing that great background. I love natural art and support local artists. And I was like, oh my gosh, I have a blank slide, but I really want to put like some natural stuff on there, some Hawaiian artwork. So I just want to shout out to her for providing that for me as well.
Thank you all. I think now we'll open it up to questions if there's any.
Mahalo, that was wonderful. Lots of gems and little stories in there. I think that will benefit a lot of our scholars that are into their nursing education. So we are going to open it up to questions. If anybody has, you can use the Q&A feature or the chat. I did have a question. One, how did you guys end up in the same room for the presentation? Especially because you're on Lanai.
Yeah, I just happened to be on Oahu this time. This is actually the first time I came to Oahu since the pandemic started. So I haven't been on Oahu since like December 2019. And, you know, because they kind of changed how we're looking at vaccinations and, you know, being able to travel more freely. I felt this was the time to come, and it just happened to work out when we're doing the presentation. So
it's like forcing me to come onto the hospital grounds.
Well, I'm just glad you guys were able to take the time out of your day and actually coordinate it together, which is kind of a nice treat for us to. I didn't realize the relationship you guys had, so that was really nice to hear. And then the other question I had is, so what do you guys do for fun?
Be a parent now. I kind of faded out from hula because of the pandemic, and I'm trying to get back into that and do a little bit of like running competitions, only because my kids do triathlon, so we're trying to get back into that scene. You know, just being at home for me is for fun and not doing any work, but that's inevitable. But you know, I miss hula. My halal goes to Mary Monarch, so I attended the last Mary Monarch with my halal, but you know, it's hard. So I do a lot of the background stuff, which like with anything, nurses play a really important role doing all the background, and I call it the grunt work to make something happen. So yeah, even though I strayed off of that for fun stuff.
I think just spending time with family, and then on Lanai, you know, we're blessed with a lot of wide open spaces, so a lot of camping and just hunting.
Yeah, I mean, especially if we're trying to talk to folks to prevent burnout and compassion fatigue, I think, you know, all of us need to remind each other about self-care and taking time off, especially as connected as we are to our electronics.
Mm-hmm. I think telemedicine makes this work a little bit more harder than seeing someone face to face.
Because you got to make up for the face to face, right?
It's so hard to assess someone, even though it's not an emergency, just by video, because now we're counting on the patient to put the iPhone or put the computer, like, hey, you have swelling in your so I do telehealth with Jared every first Wednesday. So at least I have like someone with the expertise to do that, but we don't always get that as a physician, so, or a nurse practitioner, so it's hard to do that assessment. So it takes a little bit longer. And we tend to be a little bit more even thorough. I mean, we're thorough already, but it's pretty hard because everybody's frantic and they don't know what to do.
Right, right. Does anybody have any questions out there, comments or feedback?
Just anything. Well,
we will have the recording out to send to everyone, and then also for our next webinar, it's going to be on the 28th, and we're featuring Lomi practitioner Dane Silva, and he's going to be talking about herb immunity. And then I think June 11th is King Kamehameha Day, so we won't have a webinar. So our webinars are on the 2nd and 4th Fridays of every month. But if no one has any questions, mahalo very much for taking the time out of both of your days to be with us and give us some valuable information that we'll definitely share. And especially for those that weren't able to join us, please forward your questions to us and I'll make sure that Jared and Josette get them. But we'll keep in touch and ahui ho and malama pono, everybody.
Thank you.
Ahoy ho.